So Interagency Task Force. The 2023 Spring Festival is around the corner, the first Spring Festival after we downgrade COVID. Many have embarked on the journey back to their hometowns. President Xi Jinping yesterday's video greetings to the cadre at grassroots level have emphasized the importance of pandemic response, and he provided the instruction and suggestion to be targeted in our response. Departments of the Interagency Task Force of the State Council have adopted an array of measures. They bear in mind the difficulties of the vulnerable group and enrich the cultural activities and material supply and protect the safe travel rush. Rural areas should focus on the well-functioning of pandemic response, ensure medical and medicine needs of the general public are met, with a focus on the protection of the elderly and the children, remedy deficiencies and make up loopholes. Crowded places should be well guarded against the pandemic, reduce the risk of transmission. I'd like to remind the general public to have good personal protection, and we discourage travel with the sickness. We wish all of you a healthy and happy Spring Festival. Today we will focus on pandemic response during the Spring Festival. We have with us Deputy Director of Emergency Response Department of Ministry of Transportation, Mr. Zhou Ming, DDG from the Rural Cooperative Economic Guidance Department of Ministry of Agriculture and Rural Affairs, Mr. Mao Dezhi, DDG Li Xiaoyong from the Management Department of Ministry of Culture and Tourism, Madam Guo Yanhong, Director of Emergency Response Department of NHC, and Senior Researcher Madam Chang Zhaorui from Infectious Disease Department of CDC. They will take your questions. Now the floor is open for questions. Please identify yourself before you ask questions. The first question goes to the journalist on the second row from the right side. Thank you. Financial Center of CCTV. Shortly before, the government has issued the fourth version of diagnosis and treatment protocol for treating severe illnesses. What are the features, and what is your assessment of its significance in treating severe cases? Madam Guo Yanhong is taking the question. Thank you for your question. The treatment of severe illnesses is a very important task for us. The fourth version of diagnosis and treatment protocol has been pushed forward in light of the features of Omicron and the uniqueness of the infected. It has taken shape on top of our summary and taking stock of experiences from the previous treatment. This version of the treatment protocol has the following highlights. First, we've further emphasized the importance of intervening early by adding the early warning signals for severe cases propensity. We've further clarified at-risk population. Those who haven't been diagnosed as severe illnesses, but who are over 65 with underlying diseases, who haven't completed full-course vaccination. Patients, as such, if they deteriorate into moderate cases, that is to say, they have pneumonia, but not yet severe pneumonia, they should be managed as severe illnesses. That is a way of intervening early. We've also emphasized the monitoring of the vital signs of the at-risk population. We emphasize the importance of the oxygen saturation monitoring at rest and after mobility. If there are fluctuations of the sets, patients as such will be monitored further closely for early intervention. The second major feature of the fourth version of diagnosis and treatment protocol for severe cases have been the inclusion of the previously effective methods. For example, we've added targeted therapy for high fever and constant coughing. We've emphasized the early application of oral small molecular antiviral drugs and the addition of coagulation treatment. We further improved oxygen treatment and respiratory support therapies. We emphasize the importance of prone positioning for ventilation to improve the sets. We've also emphasized the proper timing for intervening with ECMO or invasive ventilation. The third feature of the fourth version for the severe illness diagnosis and treatment is that we've optimized the content for TCM. We've improved the clinical treatment guideline for the severe and critical cases by adding TCM and better make optimal use of the advantage of TCM. Besides, we've further refined the ways of technical support. All these have the view to guide clinical physicians to provide standardized and consistent therapeutics to the patients with a view to improving the cure rate. Thank you. Next question goes to the journalist on the third row from the right side. Thank you, Mr. Moderator. China Transportation News. The Spring Festival is around the corner, and the travel rush has been on for some time. What are the data for the transportation volume? Mr. Zhou Ming is taking the question. Thank you for your question. Today is the 13th day of the Spring Festival travel rush. We are seeing the coming of the peaks. In general, rail, highway, waterway, and air transportation have been stable with sufficient transportation capacity, orderly services, and sound emergency response, and guarantee the overall situation has been stable. The transportation of coal, grain, medical supplies, and other key supplies have been kept unimpeded. According to our latest data as of yesterday, rail, highway, waterway, and air passenger reached 480 million person times, a decrease of 47% over that of 2019, but an increase of 47% over the same period of 2022. Yesterday, highway, railway, waterway, and air transportation of passengers numbered 45.69 million, quarter-on-quarter increase of 5.9%. Down by 44% over 2019, but up by 53.9% from 2022. Yesterday, the real transportation of passengers numbered 8.9 million person times, down 15% from 2019, but an increase of 27% over 2020. Waterway transportation of passengers numbered 525,000 person times, down 49.2% from 2019, up by 31.5% from 2022. Air passengers numbered 1.41 million person times, down by 24% from 2019 and 34% higher from 2022. Highway throughput across the country numbered 33.36 million, including small vehicle numbered 29.42 million vehicle times, increase of 12.7% from 2019 and an increase of 10.8% from the same period from 2022. Small vehicle throughput reached the highest in the past years of the Spring Festival travel rush. Going ahead, we will follow closely the pandemic situation, have a dynamic assessment, implement all the necessary measures to safeguard the safe travel of the general public.
Thank you. Now we allow for the questions. Thank you, moderator. I'm from the Rural News. Recently, joint agency task force and the central leading group on rural areas have issued the work protocol on preventing COVID-19 in rural areas, requiring strengthened protection of a key group of persons in rural areas. And what about the implementation result? Thank you. The floor is given to Mr. Mao Dezheng. Thank you for your question. President Xi Jinping pay high attention to key groups of persons in rural areas. Yesterday, through video linkage, he emphasized that we should emphasize the protection for elderly, disabled, pregnant lying-in women, and children in rural areas. And he has sent out many instructions previously. The working protocol you mentioned just now have making arrangement for COVID-19 protection for key rural group of persons. The task force have done 4 things. First, understand the baseline. Organize local government to carry out a baseline survey in rural areas. At present, we have sent out questionnaire to 620 million population and have understanding about 5 category of people's basic information, and we have set up a full coverage system for key group of persons. Now, 31 provinces, including Xinjiang Production Corp, have established such a coverage system. We coordinate township cadres, rural cadres, party secretary, and rural doctors, party members to cover key group of persons to ensure that every individual, every household can be covered. According to our statistic, in total, we have mobilized 18.42 million of a person to provide coverage to at-risk person. The coverage is 99.72%. In 20 provinces, the coverage is 100%, while other provinces have achieved near 100% coverage. The second method we have adopted is to send out a health kit to offer better protection to key group of persons. It's difficult for some people to have access to medical services and drugs in rural areas. That's why we have early intervention and organize a local government to send out free health kits to key group of persons. At present, we have sent out 57.17 million health kits to people at risk. For example, in Zhejiang province, they organize people to send out medical services to key group of persons, refer people at risk to upper-level hospitals, and provide agent purchasing in the amount of 3.38 million person times. We also encourage local government to explore new ways of sending out care to key group of persons. For example, in Guizhou, Pingtan province, they have knocking at the door activity, and they have a doorstep visit to key group of persons, provide health consultancy, temperature monitoring, and blood oxygen saturation testing to this group of persons, and help them to have access to basic living and medical materials. Besides this, our task force also focus on addressing the problems of shortage of ambulance, organize local governments to rely on the coverage system to establish a voluntary team for severe case transferring, get the vehicles ready so as to help the key group of persons to be transferred to upper-level hospitals. In the next step, the workforce will encourage and help local governments to strengthen the coverage system, strengthen home visits, and provide more services so as to give better care to key group of persons at rural areas. Thank you. Now we allow further question. Thank you. From CJTN. Recently, we have found out XAY.2 variant in other countries, and it has aroused concern among the public. And what's the danger of this variant, and how can we respond to such a variant? The floor is given to Madam Chang Zhaorui. Thank you for your question. And thank you for your question. Recently in Thailand, XAY.2 variant was found. It is a recombinant of BA.4/5, AY.45. It was identified in August 31, 2022 in South Africa first, now discovered in 9 countries and regions around the world. Since December, from Denmark and other regions, we are seeing a spike of the variant, but now we don't have enough transmissibility, pathogenicity, and immuno escape capability of XAY.2. We don't have enough data. We will keep update about XAY.2 and further monitor imported cases and local cases of XAY.2. Personal hygiene, wearing your mask, and have good health habits are key protection measures. Imported cases for those entry person, please keep health monitored and go to the doctors if you found the symptoms. Thank you. Now we allow further questions. Thank you, Chair. Thank you, Moderator. From People's Daily. After COVID-19 was downgraded, now, what is the total medical treatment and hospital visit situation of COVID-19 infected cases? Thank you. The floor is given to Madam Guo Yanhong. Thank you for your question. Medical treatment to COVID-19 infected patients are going on smoothly, and the hospital visits are reducing. And we have seen the passing of 3 peaks. That is fever clinic visit, emergency visit, and severe case peaks have passed. And fever clinic visits peaked at December 23, 2022, and saw a continuous decline after that. And up to January 17th, as compared to the peak, the fall was 94%, coming back to level before December 7th. And the emergency department visits peaked at January 2nd and saw a decline afterwards. In January 17th, the visit number declined by 44% as compared to peaks. The total number of hospitalized positive patients, COVID-19 positive patients, peaked in January 5th and declined afterwards. In January 17th, we saw a reduction of 44% as compared to the peak. So we have going through these 3 peaks. Now, we are seeing normalize of medical services. Outpatient visits are recovering to normal levels. Within the outpatient visits, COVID-19 cases percentage were reducing. In January 17th, non-COVID-19 patients reached 99.5% of the total. Remind us that normal outpatient visits are coming back. And we're seeing volatility of hospitalized COVID-19 patients. In January 17th, the total number of non-COVID patients reached 85%, reminding us that normalized hospitalization are coming back. And for hospitalized operation amounts, from December 9th to 31st, the amount was declining. However, after January 1st, the amount was increasing. And in January 17th, as compared to December 7th, the amount of hospitalized operation increased by 20%. All these indicators are showing us that we are seeing the coming back of normalized medical services. Thank you. Now we allow further questions.
Thank you, Mr. Moderator. With China Southern Daily, children are the key group in our response. How can we provide popular science of a pandemic response for children, and what should parents do to improve the personal protective awareness of the children? Madam Chang Zhaorui is taking a question. Children are the key group in our response. Children themselves do not have sufficient knowledge on the virus infection. Popular science information should be properly educated from various channels. First, we should train their teachers, their parents, and other guardians. Second, the way of publicity and communication should be easily understood and interesting to children, like children's songs, animation, or children's books. For children of different age groups, the content should be targeted and use the language or the words that are easily understood by the age group. Information and science should go to their classrooms, and they can have some role-playing or games or the teaching by teachers. Parents should also act in a proper way to show their children how can keep a good, healthy habit. The parents should lead by and teach by example. Like after parents come home, they should have their hands washed, and when they cough, they should follow the respiratory etiquette. Parents can also help children to work out some plans to have a better physique, exercises, proper diets, and encourage the right practices of the children. Hong Kong Economic Herald News. I have a question for the Ministry of Tourism and Culture. Starting from January the 8th, COVID has been downgraded into Class B infectious disease. What are the measures adopted by the Ministry for the cultural, recreational, and tourism venues? Mr. Li Xiaoyong is taking the question. Thank you for your question. The Ministry of Culture and Tourism have always attached a great importance to the pandemic response after COVID has been downgraded in accordance with the requirements of the State Council. We've been upholding scientific response, refining our targeted policies, and combined pandemic response with emergency response. We've been focusing on the following aspects. First, we have improved the industry work deployment. Shortly before we convened the televised conference and deployed efforts of a response after we downgrade COVID, we require localities to be accurate and comprehensive in implementing the response policies. In light of their local conditions, customize their response to realize stable transition. Second, we've optimized and adjusted the response policies. According to the overall plan, we've issued policy circulars on improving response by the cultural and tourism industry. The venues and operators of the cultural, recreational, and tourism industries must ventilate their places and reduce the risk of transmission. Emergency measures can be adopted when deemed necessary and in accordance with law in a decisive manner. Third, we've been communicating with other departments, in particular National Health Commission, NDCPA, Ministry of Transportation, and the Border Control departments. We've been working along with the ad hoc committee for managing the travel rush of the Spring Festival to ensure safe and orderly travel of the passengers. Going ahead, we will continue to guide operators and organizations to implement their accountability in pandemic response after we downgrade COVID and ensure orderly flow of the personnel. Departments at different localities will provide inspection and correct wrongdoings to ensure ensure all the measures are well operationalized. Thank you. Next question goes to the journalist on the second row from the left side. With the CCTV, shortly before, some rural areas had complained about the insufficiency of health institutions, in particular the shortage of the testing equipment. How will we address the situation? I'd like to invite Mr. Mauderchi to take the question. Thank you for your question. As you've rightly pointed out, shortly before, some rural areas have complained about the shortage of health resources. And that has been one of the sticking loophole in our rural response. Our ad hoc committee has been making efforts in the following aspects. First, we've worked along with the National Health Commission, MIT, and the Ministry of Finance. The Central Finance has allocated and transferred resources to rural areas. Health professionals have been dispatched to rural areas. The ad hoc committee have improved the monitoring and inspection. We've dispatched 32 contingent teams to different localities to inspect the local efforts and guide localities to implement the measures, enhance accountability, set up a working mechanism to promote the problems to be resolved and reach the unreached. We've also set up work rescheduling system to meet the needs of medical resources by localities. We've also mobilized all sectors of life to deal with the issue. In light of the shortage of pulse oximeter and SATS monitors shortage, we've been working along with all sectors of life to enhance the coverage. All the village clinics must be equipped with pulse oximeters, and all the health institutions and clinics in the towns and township level must be equipped with the oximeter. Over 1.7 million oxygen meters have been equipped and delivered to these health institutions. 77% of the planned amount have been distributed to the village hospitals. The day before yesterday, the second batch of oxygen generators have been distributed. So all these institutions at the village level will be equipped with the pulse oximeters and the oxygen generators. We will also donate small molecular antiviral drugs to some rural areas to deal with the weaknesses of medicine supplies. There are still unreached rural areas. These shortages are in some patchy regions, and some are because of the structural deficiency, especially because of the various needs by health institutions or patients. And some of the shortages are only limited to certain spans of time. Health and medical resources are saving lives. Being it the regional or patchy, structural or phasal shortages are important weaknesses that we must address. Going ahead, the ad hoc committee will further implement the general guidance from President Xi Jinping in reaching the unreached and making up the loopholes in rural areas. Will work along with relevant departments to act on our responsibilities and make up the loopholes, ensure targeted distribution of medicines to needy areas. Next question goes to the journalist on the right side. Thank you. With Phoenix TV, during the travel rush of the Spring Festival, apart from taking public transportation vehicles, many choose to drive on their own. What are the safeguarding measures adopted by Ministry of Transportation to ensure safe drives?
The floor is given to Mr. Zhou Mi. Thank you for your interest in self-drive. Because of the pandemic, and released demand for hometown visit, family visit, and tourist sightseeing. According to our forecast, self-drive will take up 60% of the total passenger throughput. And since January 7th, the highway small vehicle passenger traffic are increasing from 76% in January 7th to 88% in January 18th of the total. And in January 18th, the total highway small vehicle traffic reached 320 million vehicles, an increase of 12.7% as compared to 2022, an increase of 11.8% as compared to 2019. To ensure safe travel, and the Ministry of Transportation have emphasized the two works in areas with high traffic and high population density. First, we continuously encourage ventilation, disinfection, and personal protection. Every day, ventilation should be increased to 2 times and disinfection 1 time. And during the Spring Festival, the disinfection and ventilation frequency should be increased. We also strengthen communication among industry practitioners, encourage all drivers and service people on the bus to wear masks, and also ensure smooth operation of the service area. Second, strengthen aid to COVID-19 cases. In qualified service area, we provide a special area to provide services to COVID-19 infected drivers and attendant, and we also provide emergency care to drivers and attendant if they are in need. We encourage drivers to have a good plan of their visit and monitor their health, and don't travel while they are sick, and avoid going to places with high population density. Thank you. Now we allow for further question. I'm from the paper. So we should prioritize the basic rural areas. And what about the fever clinic visit in those areas? And are there adequate equipment and drugs in rural areas? Do we have arrangement for severe case referral? The floor is given to Madam Go Yanhong. Thank you for your question. For grassroots medical treatment and fever clinic arrangement, this is our priority. At present, township hospitals and health centers have set up fever clinics, and the coverage reached 98.8%. At present, township hospitals' fever clinic setup rate reached 99.1%. It is required that during the Spring Festival, all the fever clinics should be kept open, and we should have a normal operation of those fever clinics. With increased travel while the Spring Festival is approaching, we should be prepared for better services at rural areas. We have done the following work for early identification, early disposal, and early referral. First, we work on equipment facilities. We provide better facilities to rural hospitals, provide them with oxygen cylinder, oxygen generator, oximeter, and others. At the end of January 17th, in total, we provide 2.47 million oximeter to grassroots institutions. And in total, we have provided 191,000 oxygen generators to rural health institutions. And for drug supply, we set up a monitoring and dispatching system. At present, township hospitals have a regular supply of drugs, and the drug shortage has been addressed. Well, for staff preparation, we organize the rural hospitals to have a better arrangement of shifts, have temporary recruitment, and have support from secondary and tertiary hospitals. In this way, we can have a steady supply of staff. We also encourage training. And in terms of referral, we have strengthened the capacity of ambulance supply. And every township hospital should at least have one ambulance. And we also encourage persons to provide voluntary vehicles to ensure adequate vehicle supply for referral. We also set up a green channel to take in the severe case referred to the upper level hospital. Thank you. Now we allow for the questions. Thank you, moderator. From Macau Monthly, for people who have not been infected with COVID-19 virus, can they go back to their hometown? Are they at a greater risk of infection? What are the suggestions for their protection? And for already infected person, do they need to have personal protection during travel process? The floor is given to Madam Chang Zhaorui. Thank you for your question. People are susceptible to COVID-19 infection. Non-infected person during the Spring Festival rush, because of travel fatigue, they are at a higher risk of infection. We suggest people to have personal protection, have a regular rest, and keep a healthy and balanced diet and proper exercise. And even if you have infected with COVID-19, you should continuously protect yourself and prevent against other respiratory infectious disease. Thank you. We allow for the question. Thank you, moderator. From Economic Daily News. During the Spring Festival, the passenger throughput is increased. What has been done by the Ministry of Transportation to provide better services and to prevent COVID-19 infection during the transportation process? The floor is given to Zhou Min. Thank you for your question. And this is the first Spring Festival after COVID-19 mass infection in China, and we have come up a plan and printed out guidelines and make arrangement for doing a better job in following four aspects. First, we strengthen disinfection and ventilation in service area and transportation vehicle. And we have a daily disinfection and ventilation on transportation vehicle. During the transit process and after the transit, we will open the door for and open the window for ventilation. Second, we strengthen staff management. All the staff should wear masks and keep hand hygiene, avoid contact with the public, and wear N95, KN95 mask. And if they get infected with COVID-19, they should go back to work after recovery. Third, we optimize transportation services. We increase transportation capacity and increase transportation frequency so as to provide the last mile service to the public. We also organize night bus, shuttle bus, in line with the needs of the passengers, and we have a contactless tickets buying, encourage people to have a scattered seating while waiting for the bus, and we provide antipyretics and disinfectant and mask at key areas, and we guide the public to have a staggered visit and remind the passengers to wear masks, keep their hand hygiene, and maintain social distancing while taking the public transportation vehicles. We encourage all of you to monitor your personal health and avoid taking the public transit vehicles where you are sick, and keep yourself protected during the transit. Thank you. Thank you, moderator, from the paper. And how can we play the role of expert in severe case treatment for COVID-19 cases? And what are the measures have been adopted by those experts? Thank you. The floor is given to Madam Guo Yanhong.
Thank you for your question. We've always given special attention to the technical support and guidance from experts. From the very beginning of the pandemic, we've established a world-rounding online and offline cross-disciplinary consultancy working mechanism among the national experts, and they've played an important role in improving cure rate. Shortly before we further improved the relevant working mechanism, we've constantly improved the guidance and support to different localities. First, we've organized national high-caliber experts with rich experiences of treating severe illnesses, and they are accountable for different regions, and they go to different provinces to provide the world-rounding among the severe illnesses and provide on-site guidance. Since last December, we've dispatched 3 batches of 29 contingents of national experts to different localities to provide world-rounding and consultancy services. And we've covered all provinces. Second, we've organized national experts to have online consultancy for the most difficult to treat cases. Since the outbreak of the pandemic, we've organized over 100 online cross-disciplinary consultancy among national experts and provided consultancy services for over 1,000 intricate and difficult to treat cases. Since January this year, to step up our efforts, we've specially made arrangements in organizing 10 standing teams of national experts who can provide on-demand online consultancy services to severe cases among different provinces. On top of this existing mechanism, provinces have set up a provincial and municipal level of the world-rounding and consultancy services, with provincial experts going to municipalities and municipal experts going to lower level of hospitals to provide hands-on support. Going ahead, we will continue to make full use of the existing mechanism to provide experts guidance to local hospitals and thus improving the treatment capacity of local hospitals in treating and handling severe illnesses. The next question goes to the journalist on the second row from the right side with Health Times. In face of uncertainties, will we bring risk of infection if we visit seniors during the Spring Festival? If we do need to visit seniors, how should we protect them? And if the elderly and other at-risk people do need to go out, how should they be better protected? Madam Chang Zhaori is taking the question. This Spring Festival is the first Spring Festival after we downgrade COVID. As to the principles of safeguard before and during and after the travel, a lot of information has already been shared on previous conferences. And the upcoming Spring Festival will see a large volume of mobility and a greater risk of transmission in remote areas for seniors, especially those who suffer from underlying diseases. If they haven't been vaccinated, we should provide them with special protection. After you go back to your hometowns, the returnees need to wear masks when you visit seniors and pay special attention to respiratory etiquette. Second, apart from monitoring your own health, you should follow closely the physique of the seniors. If they show symptoms of COVID, or if they test positive, they need to seek medical services. Third, during dining, we suggest separate dishes and use serving chopsticks, and we discourage the elderly to participate in large-scale group activities, reduce the scale of the groups, shorten the time of the dining. Fifth, discourage the elderly to go to crowded places and discourage them from taking long-haul journeys. If they do need to go outside, they must wear well-fitting masks and well-fitting to cover their nose and mouth. And if they go to crowded places, they are advised to wear N95 or surgical masks and replace the mask as necessary. Pay special attention to hand hygiene and respiratory etiquette. Thank you. Last two questions. Journalist from the first row from the right side, left side, with the CNS. According to the protocol on stepping up response in rural areas, localities are requested to further improve the response accountability system with the party secretaries as the primary accountable people, and how will this be implemented in rural areas? Mr. Mao Dezhi is taking the question. Thank you for your question. President Xi Jinping, in his yesterday's televised greetings to grassroots cadres, emphasized again that just like we cracked the hard nut of poverty alleviation, party secretaries at 5 levels in rural areas must take primary accountability in addressing the pandemic. Localities have acted swiftly and further improved the accountability system by party secretaries. At the provincial level, provincial party secretary and party leaders will further implement a better organization of a pandemic response, make specific deployment, and go to rural areas to provide on-site inspection and guidance. Shortly before, we've made further redeployment in rural areas in pandemic response. The city, town, township, and village levels have further improved the party leader accountability system working mechanism. Party secretaries must ensure they act on these measures at the grassroots level. The party organizations at the rural areas are the mainstay in fighting the battle, and they organize the village leaders to implement and refine the response measures. Many localities have set up a list of at-risk population by trawling survey. They have prepared personnel and transportation vehicles to transfer the needed to the hospitals. They've also improved the management of key venues. In Tongshan District, Yuejing village of Jiangsu Province, the party secretary has set up several teams, including the disinfection team, the team for collecting medical wastes, providing medical supplies, and the team for transferring the needy patients. Going ahead, the ad hoc committee on rural areas will continue to be targeted on key issues. In particular, during the Spring Festival, many will visit their families and friends. There will be increased activities like weddings and funerals and temple fairs. So party secretaries and party leaders will further implement their obligations, perform their duties, and organize the villages to refine and intensify their efforts. While all these efforts are taken, they must take affectionate steps, and they should avoid oversimplified approaches or heavy-handed management. Cadres at grassroots level are shouldered with a cumbersome burden. We hope all the rural citizens can provide them with more understanding and support. We should tide over the difficulties and stick together through thick and thin and have a safe and healthy Spring Festival.
Now we allow for the question, the final question. Thank you. From People's Daily. The Spring Festival is coming. People have a stronger desire for outdoor visit, and many platforms have increased the order and consultancy for tourism. And what are the measures adopted to prevent COVID-19 during the Spring Festival? And what are the reminders for the passengers and the tourists? The floor is given to Mr. Li Xiaoyong. Thank you for your question. The Spring Festival is the first Spring Festival after downgrading of COVID-19 to Class B infectious disease. People have a stronger demand for family visit, hometown visit, and sightseeing. Region mobility are increasing. In accordance with our arrangement, we have done the following work. First, strengthen early warning and monitoring. According to Ministry of Culture and Tourism, according to our forecast, this spring we will see large passenger throughput in Shenzhen, Zhengzhou, Shanghai, Changsha, Sanya, and other cities. And we have issue forecast to those cities and regions, get them prepared for these passengers and tourists. Second, strengthen emergency preparation. Ministry of Culture and Tourism, in line with the overall plan of Class B infectious disease management and the 10 version of the COVID-19 management, we issued a notice require local governments to be prepared for emergencies. And when emergency happens, they should report to the ministry at the first time and organize treatment. Thirdly, we strengthen communication and we release tourist reminders and guide the tourists to have rational arrangement of their travel plan and guide local bureaus of culture and tourism to communicate COVID-19 response knowledge to self-driving passengers and tourists and encourage scientific COVID-19 prevention. The Spring Festival is coming. We remind the tourists to have a sound arrangement of their travel routes and keep their personal health protected and to be the person responsible for their health so that we can have a healthy and happy Spring Festival. Thank you. And we have invited in the guests to introduce you about our COVID-19 response during the Spring Festival. This is our final prizer in the Year of Tiger. I wish you a happy new year in the year of rabbit. Thank you. That's the end of this year's press conference. Thank you.